There are days when we feel like our bodies are not what they used to be, but we don't know why. But what if one of the most important organs in our body is slowly failing without any obvious cry for help? One day, we feel more tired than usual. One night, we have trouble sleeping because of a persistent itch. One morning, we wake up with bad breath or heavy legs for no reason. You ignore it because you think maybe it's because of old age, but what if those little signs are early warning signs from the kidneys, vital organs that we often forget? In today's video, we will explore 7 silent but dangerous signs that, if recognized in time, you can save your kidneys before it's too late. And this is not just information. It's an opportunity for you to prolong your health, independence, and quality of life in your most important years. Listen to your body. Start with seemingly small changes. The video will start now. Sign 1, unusual urine, a mirror of kidney health. Have any of us ever stopped after a trip to the toilet and noticed something unusual? A thin layer of foam rolling on the surface of the water, or a hint of pink in the urinal. These seemingly small things, in fact, can be the first warning that the body is sending. Every time you urinate, it is an opportunity to listen to yourself. Because urine, seemingly meaningless, is the most honest mirror reflecting the functioning of the kidneys. When the kidneys are weakened, the filter membrane is no longer strong, and protein, which should be retained in the blood, begins to leak out. And that is the reason why urine foams like beaten egg whites. If there is blood, even just a faint pink streak, it could be an injury, infection, or even an early sign of urinary tract cancer. In older people, this small change is often overlooked, partly because of the habit of enduring, partly because of shyness, considering it a sensitive matter that is difficult to talk about. But it is this silence that has caused many cases of kidney disease to be discovered only when it is too late. The kidneys do not know how to cry out in pain, but urine will speak for it. And if you listen early enough, a person's life can change in a more positive direction. But if you ignore it, the body will continue to speak up, with other, more obvious signs, such as unexplained, persistent fatigue. Let's move on to the second sign. When energy is depleted for no reason, it is a cry for help from within. Sign 2, chronic fatigue, when the body no longer has enough energy. Waking up in the morning, the whole body feels drained of energy. Even though you have slept early, eaten enough meals, the feeling of fatigue still does not let go. The body feels heavy, the mind is hazy, as if every step requires effort. Many people think, maybe it's because I'm old, but if that fatigue lasts for a long time, for no apparent reason, and does not go away after resting, then it is very possible that it is not age, but a silent cry for help from the kidneys. When kidney function declines, the body no longer produces enough of an important hormone called erythropoietin, a factor that stimulates the bone marrow to produce red blood cells. The result is anemia, lack of oxygen, and every cell in the body seems to be living in a state of lack of oxygen. The body reacts by making us constantly tired, dizzy, heart palpitations, and even having trouble sleeping. This is not a natural decline, but a serious imbalance in the system. Older people often have the habit of accepting it as inevitable. But the truth is, when the cause is identified and treated in the right direction, this feeling can be completely relieved. And if fatigue is making the legs not want to continue walking, the next sign is the legs start to speak up. Let's come to sign number 3, when leg swelling becomes the silent but most obvious sign that the kidneys send. Sign 3. Leg swelling, a silent warning from the filter system. Indeed, many people after the age of 55 begin to realize that their legs are no longer as flexible as before. Standing for a long time makes you feel heavy, and at the end of the day, taking off your sandals, you see deep marks on your ankles. Slight swelling, aching, then you get used to it. And then ignore it. But it is the silent change in your feet that can be the clearest signal that your kidneys are trying to send out. When the kidney's filtering function is impaired, sodium and water are not eliminated effectively, and as a result, fluid begins to accumulate in the lower limbs, causing edema, especially in the feet, ankles, and calves, the areas that bear the most pressure and are also the places where blood circulation is most difficult. The worrying thing is that foot swelling is easily misunderstood. It is due to standing too much, tired walking, the weather, or aging. But if the swelling persists, does not decrease despite rest, and is accompanied by a feeling of heaviness and discomfort, it is no longer normal. It is an urgent whisper from the blood filtering system that the kidneys are working too hard, and if even your legs start to react, then breathing, which seems so simple, may also be affected. Let's move on to the fourth sign, where every breath becomes precious and signals a danger that cannot be ignored. Sign 4, shortness of breath. When the kidneys silently put pressure on the lungs, sometimes you lie down to rest. But instead of feeling relaxed, you feel short of breath, suffocated, as if someone is pressing down on your chest. No cough, no fever, no obvious heart disease, but each breath becomes more labored, as if sinking in water. If that happens, be alert, because it is very possible that the kidneys are sending a distress signal. The feeling of shortness of breath does not always come from the lungs or heart. Few people expect that the kidneys, the blood filtering organs, when weakened, can also obstruct breathing. When the kidneys can no longer filter excess fluid in the body, that fluid begins to accumulate not only in the legs but also in the lungs. And when the fluid rises to the lungs, each inhalation becomes a struggle. This happens silently and slowly, especially when lying down, because fluid tends to accumulate in the chest area. And unfortunately, many older people still think that shortness of breath is due to age or lack of exercise, so few people check their kidneys until they have to go to the hospital in an emergency. Breathing is life, and if life also becomes tiring, then that is when we can no longer be silent. And if the kidneys can affect breathing, then the skin, which covers the entire body, will also speak up in its own way. Let's continue with sign number 5. Itching and skin changes which seem to be only external but reflect deep damage inside. Sign 5, itchy skin and changes in color when the body no longer filters the blood. Persistent itching. For no apparent reason, no rash, no allergy, but it keeps coming back, especially at night. Then one day, the skin suddenly becomes dry, dull, losing its elasticity and vitality. Many people consider it a small matter, a normal manifestation of aging, but behind these seemingly harmless changes could be a silent warning from the gradually weakening kidneys. When the kidneys are no longer able to filter the blood, waste products such as urea and uric acid, instead of being excreted, begin to accumulate in the body, and the skin, as a side door of the excretory system, is forced to speak up on behalf of the kidneys. That's when the itch starts. No rash, but tingling under the skin. No bleeding, but scratching won't stop. That's when the skin becomes dry, cracked, and loses its natural color due to mineral disorders and homeostasis. The skin is a mirror of the internal organs. And when the skin changes, it means that something is wrong inside the body. Many older people ignore this sign. They buy topical medications thinking it's just dry skin due to the weather. But if the itching persists, especially at night, accompanied by fatigue, weight loss, or changes in skin color, it's no longer a dermatological problem, but a warning sign from within the bloodstream, and if the skin has spoken, then the mouth will be next, the place that directly contacts the breath and odor of the body itself. Let's continue with sign number 6, when the metallic taste in the mouth and abnormal breath become a serious reminder from the blood that is full of toxin. Sign 6, metallic taste in the mouth and breath, smell. When the blood is full of toxins, sometimes the body sends signals not through pain, but through taste. One morning, a familiar dish suddenly becomes strange, bland, hard to swallow, or somewhere there is a strange iron or metal taste lingering in the mouth. Then you realize, despite your thorough oral hygiene, your breath still carries a fishy, slightly pungent smell, as if something unusual is happening inside. This is not a problem with the teeth, nor is it due to the food. It is the blood overloaded with toxins, looking for a way out, and the place it chooses to speak up is the mouth. When the kidneys are weak, waste products like urea are no longer filtered out as usual. They accumulate in the blood, then spread to the salivary glands, changing both breathing and taste, causing the patient to gradually lose appetite, eat less, and lose weight without knowing the reason. Many people suffer silently, thinking that it is just a sign of old age. But for relatives living close by, the smell of breath is the first thing they can notice if they pay attention. And sometimes, just a small question from the person next to them. Why does my mouth smell strange today? Can also save a kidney that is silently exhausted. But the story doesn't stop there. As the toxins continue to spread deeper into the bloodstream, the brain, which needs clean oxygen to be clear-headed every day, will also begin to malfunction. Let's go to sign number 7, when memory, alertness, and balance start to falter. Sign 7, dizziness and loss of concentration. The brain speaks out when it's lack of oxygen. Have you ever stood up and felt everything swaying? A slight dizziness. And then you said to yourself, I must have stood up too fast. Then recently, you've noticed that you often forget where you put your keys, lose your train of thought in the middle of a conversation, or have to struggle to remember a simple task you were about to do. People often say it's old age, but sometimes it's a silent cry for help from the brain, because it's seriously lacking oxygen. When the kidneys fail, the blood-making process is interrupted. The body doesn't produce enough red blood cells, leading to anemia. And when the blood lacks oxygen, the brain is the first place to be affected. Because the brain, although only accounting for 2% of the body's weight, consumes up to 20% of the oxygen to maintain memory, alertness, concentration, and even emotions. So just a small drop in blood oxygen is enough to make the mind become vague, lose balance, or have short, scary forgetfulness. Unfortunately, many older people are hesitant to mention memory loss for fear of being labeled confused. But if the cause comes from the kidneys, it is completely correctable. Don't let the silence of the body fool you. Small signs today may be the last chance to reverse a major disease. Let's go to the end to understand. If we have recognized one or more of the 7 warning signs, what should we do right now to protect our kidneys and the life ahead? Summary. Don't wait for your kidneys to speak up with pain. Take action at the smallest signs. The 7 signs, from foamy urine to dull fatigue, from swollen feet to a metallic taste in your mouth, are not random. They are important signals your body is trying to send, saying, "Your kidneys are having problems, please pay attention." It is alarming that up to 90% of people with kidney failure do not know they have the disease. They still live, still work, still eat as usual until everything becomes too late. 2. The kidney, like a car engine, can work silently, but if not checked and cared for regularly, the damage will come unexpectedly and be very expensive to repair. The good news is many kidney problems can be prevented or slowed if caught early. Don't panic, but take action. See your doctor regularly, especially if you're over 55 or have a history of high blood pressure or diabetes. Drink plenty of water every day, preferably warm water. One study found that drinking 1 liter of warm water within 30 minutes significantly reduced creatinine and urea, limit unnecessary painkillers and antibiotics, as they can damage the kidneys. Do light exercise, such as walking every day, to help your blood circulate and keep your blood pressure stable. Listen to your body and don't overlook small changes. Sometimes they can mean the difference between a simple adjustment and a long-term treatment. If you're feeling anxious, remember that you're not alone. Millions of people around the world are living healthy lives thanks to early detection and appropriate lifestyle changes. And if this video has helped you better understand the early warning signs of kidney disease, please share it with your family and friends, because someone might need this information. Finally, don't forget to like, subscribe to the channel, and turn on the notification bell so you don't miss the next important health videos. Thank you for listening, and always love your body, starting with the silent but extremely essential kidney. Thank you for watching. See you in the next video.